presentations will really focus on the key elements in having successful worksite centers, and that's really addressing the primary care access and addressing the chronic disease issues. You can't be successful unless you reach out and get those people, and you've got to find different ways of doing so. So our first presentation will be on expanding primary care access through near-site centers and virtual care. And I'm pleased to have with us today Heather Myers, Vice President of Operations for Premise Health, and Whitney Conley, Experienced Strategy and Transformational Lead at Humana in Louisville, to talk about this topic and their experience. So please welcome Heather and Whitney.
Well, thank you, everyone. We are so honored to be here together. And as Larry just mentioned, my name's Heather Myers, and I'm Senior Vice President of Operations for Premise Health. And I've been working in the healthcare industry for the past 22 years. I started my career in healthcare with a large hospital system in the Chicagoland area. And then I joined Premise Health 14 years ago. So I have, started my career with Premise over the past 14 years in a provider role. I am a family nurse practitioner, and then I have transitioned into various operations leadership roles. So I'm honored to be here and honored to be next to this fine human being. So I'll let Whitney introduce herself.
Okay. Hi, everyone. I've met some of you before. Whitney Conley, been with Humana for 16 years, and I manage our on-site and near-site and virtual care delivery solutions for Humana associates and their families. So I'm grateful to be here today.
So before we get started on our topic this afternoon on expanding primary care access, I really want to do a deeper dive. There we go. I really want to do a deeper dive of the why. And there's been so many themes throughout this morning. And so, I'm just going to continue on with a lot of those themes. A lot of employers have spent the last 2.5 years really focused on the COVID-19 pandemic. And we're starting to see the shift from business leaders where they're starting to look at some of these macro level trends and how some of those trends are really impacting their employee population. So first, the pandemic, led to a decrease of primary care practices or independent primary care practices. And that certainly just exacerbated some of the issues that we've already been seeing in the primary care space. We've seen a shortage of primary care providers, a shortage of primary care physicians. And then we also have started seeing that more and more individuals are delaying their care. They're delaying when they are seeing any type of healthcare provider, whether it's their primary care provider or whether it is a specialist. So we've got this, terrible shift that's occurring where we've got decreased access. And then we're also seeing that, when patients are seeking any type of healthcare services at this point, that they're sicker. We're seeing, worse outcomes. So what happens to the employer, when that bubble starts to burst? So that's certainly on the minds of business leaders and employers. And then additionally, we're facing the tightest labor market than we've seen in many, many decades, over 50 years. And not only is that one of the major concerns of business leaders and employers, but certainly that's one of the top concerns. So it's really important at this time for business leaders to really develop that total reward strategy. What does culture look like to them? And especially when you try to relate the importance of both benefits and culture with retention. It's so critical to get people in the door for your companies, but it's even more critical to retain them. So I'm very pleased to be able to present today to really allow Whitney to share her story with both Whitney and the Humana team with what they've done with their total reward strategy, looking at culture, looking at benefits, and really driving to the strategy of direct healthcare and what it can do for recruiting, retention, culture, clinical outcomes, all those things that are really going to drive down the cost, and you're going to have healthier and more productive employees. So Premise Health and Humana, we have been partners since 2021, and we've worked together to really develop this healthcare strategy for the needs of their total population. So Whitney, if you don't mind, we've got a lot of great slides up here with pictures of Humana, but if you could just talk a little bit more about your population and the Humana culture.
Yeah, sure. Happy to. And a couple of things I already shared with Heather. I'm going to go a little off script. I know the topic is around near site and virtual care. And I feel like we've talked a ton about it already today, the needs of different employers. So I'm also going to shift to make this sort of a Humana journey experience, just as a case study for some of the other clients or potential clients in the room, just to see what we've been doing. So Humana is a health and well-being company. We have 52,000 employees. We're headquartered in Louisville, Kentucky, and we have a number of different types of workers. We're pretty complex. So we have, of course, our insurance side of the house, which most people are most familiar with. We have a PBM. We also have retail and pharmacy distribution centers. We provide in-home caregiving. We also have primary care clinics for Medicare members. So we just have a bunch of folks, a bunch of different people. But the one thing I think that is true for us is that healthcare and well-being are the model in which we want to serve our own. And so it's embedded in everything we do. I'll share with you right here our Humana well-being model. So we call these our dimensions or our pillars. And so it's purpose, health, belonging, and security. So each of the initiatives that we offer our employees, whether it's a benefit or a program, aligns with one of these pillars. And we decided in 2012 to open our first on-site clinic in Louisville, our second in 2015, and then branched out into a near site in 21, and then opened up another on-site in Tampa in 21 as well. Currently, we have 21,000 eligible lives in Louisville and then 4,700 in Tampa. All right, so these are actually pictures of our place. So happy to share with you. If you were to walk through the halls of Humana, here's some of the things you'll experience. But really, we build our entire culture around wellness. A lot of it is taken from associate surveys. We probably over-survey our people, but you'll see we have free coffee and we have a Somadome if you need a place to just sit in on a pod and relax. And we offer on-site gaming of all kinds. We have foosball and ping pong and Pac-Man. Everybody loves Pac-Man. And all kinds of different games available. We also have many collaboration spaces. We've moved away from cubicles for the most part and have sort of these hybrid hoteling spots. And then we also have on-site fitness centers. We have a Humana radio station. What else do we have? What else do we have? We have a teaching kitchen. We have a newsroom. Let's see. I know we talked about on-site work style. So we have treadmill desks for our employees if they request them. So anyway, if you're coming to work, we're looking for a way for you to find what wellness means to you. And it's pretty exciting. And I think the challenge for employers is to then think about, now that a lot of our workforce is remote, how do we replicate this wellness experience for the rest of the population? And also not to exclude people. If we're having an event and the radio station's there and we're all coming together, we want to make sure that that experience is applied for everyone. And our on-site health centers, I was actually really pleased about the whole clinic thing, because our health centers are named the Humana Health and Wellbeing Centers. So, but I refer to it as the clinic, so I'll try and change my terminology. But yeah, so I just wanted to share. And we also have wellbeing champions. For those of you in the room who don't have wellbeing champions, we have 250 people throughout the organization, and their one job is to make sure that their teams are educated on what we're doing for well-being in the company. And then our clinics are such a large part of what we offer, not only from on-site care, but for virtual care opportunities, and then in our near-site establishments. Thank you.
Okay, so in order to meet the needs of all those many Humana members, the Humana associates, and also their families, so dependents and spouses, Premise Health and Humana, we really designed this omni-channel of services. You heard Whitney mention, it's not just on-site care. It's also near-site centers. It's also digital, virtual products. So Whitney, can you talk a little bit more about how this channel of numerous access points has really met the member where they are? So met the Humana associates, got, driven your wellness culture into, some of the model and the services that we're providing?
Yeah, no, happy to. So let me just give you a stat. So before the pandemic, we had 70% of our people in a building. And then the pandemic hit, and we now have 20 to 25%. That's a huge number of people to not only relocate. And I remember the day, March 12th, and we got on an all hands call and we sent everyone home. If you weren't in an essential facility, then you were at home, and everyone was packing up their laptops and their PCs, their tower computers, everything into their cars and going to their next destination. And many of our associates didn't have home internet. And, there's just a lot that goes into making sure that your people are taken care of. And Humana was very generous and helpful during the pandemic. And one of the things we realized is that the voice of our associates is truly helpful in determining not only how they want to work, but where they want to work. And so we actually gave people choice. And so we offered them whatever work style meets their needs is the one that they can come back to work in. So we now have 5 different work styles, typical to some of the others we've heard. We have home, we have hybrid office, and field. So what that means for us is that we need to create opportunities for people to explore their health and to get the care that they need, regardless of modality, because that's what we've done with the way that they're working. We also have found new ways, and I'll talk a lot about this, but we offer outdoor office events. So Humana yesterday, for instance, we rented out Slugger Field. So if you're in Louisville, give me a buzz and we'll do some sightseeing. But we rented out Slugger Field and did a pop-up office event. And so for those remote workers, they can come and bring their laptop and they have Wi-Fi and free lunch. And so we've had a couple of those events. And then our clinics have been a great support during those events to come and meet the people where they are in a physical capacity. So, yeah. I think this is pretty typical for what we're seeing across the board for some other some clinics, but I want to share with you a couple of things that we found along the way that have helped us to design our services. One is, again, understanding the needs of the patient. So one of the things we found in claims, so this is in 2019, we went into data and we found out that in Louisville specifically, we had over 200 associates a month who were leaving campus to go to physical therapy. So, and that's a 3-hour round trip. So that's an hour there, and then you're waiting, and then an hour visit, and then an hour return. So just looking at the outbound spend, the outbound time, the loss in productivity, it was a no-brainer for us to think about bringing in-house physical therapy services. And I'll share that it's rocking. I mean, we've had to add another physical therapist. We are looking at different locations now, and we're not on a wait list, but we're definitely thinking about ways to expand our physical therapy reach. Our physical therapists are going to desks. So for the people who are in the office, they can come back and do an ergonomic check and make that, one-on-one connection. Another thing I'll highlight here that's been a big member draw for us is allergy shots. So a lot of folks have to leave to go get their allergy shots, and that's something that's routine. It's something every week or every other week. Man, let's just bring your serum over and keep it here and we'll do it for you. And it's just a great convenience for our people. So really hearing some of those things from the patients helped us to design some of the services that we offer. Finally, I'll talk about our 24/7 virtual care. I've got 2 kids. Those kids get sick on Friday night at 8:30. That's it. They do. And so we need 24/7 virtual care available to our people. And then the other thing we heard from folks is just trying to get referrals. Oh my word, and understanding where to go next. And so definitely partnering to make that care management and care navigation experience easier.
And Whitney, I appreciate that you called out that, physical therapy has been such a huge hitter when it
Yeah,
comes to
yeah.
services, but then also allergy shots. If you're thinking of expanding primary care access, those are some of the things that you want to consider, because you want to get people in the doors, you want to get them engaged into services, and then it's hard for them to then not be engaged or even to be disengaged after that. Once they get inside, these on-site health centers and near-site health centers, it's just the relationships that they're able to build, not only with the providers, but the whole care team and this integrated care team with primary care, physical therapy, where that's where we can start to work our magic and to start help with controlling, not only their chronic conditions, but also helping them to control downstream care costs for the employers too.
I think so. And two other things I'll mention quickly, just one around the physical therapy and offering a virtual option. So in Tampa, for instance, we don't have a physical therapy presence, an in-person presence. So offering that virtual capability, I too am in physical therapy now. And it's fantastic to have that opportunity on your own family room floor to say, what are the things around me that I can reach, that I can use to help me to continue, my flexibility and growth, even if I'm not coming into the office. We've also dedicated parking spaces for those people. So if you're a patient who's coming in for physical therapy, perhaps you can't walk. So we've dedicated, space for them to be able to park and come in easily. So it's just thinking about the experience of those folks. The other thing I wanted to mention, and I should have said something in an earlier slide, but we do include all Humana associates and their covered dependents as part of our on-site, near-site, and virtual offering. And we start at newborn and above. So we have the little bitty bitties in there also.
Okay, so despite Humana's decision of offering permanent work from home flexibility, not only has Humana, continued to maintain an on-site center presence, but you've expanded services during this time. We heard near site going live in 2021, virtual care was another expansion. How are you really leveraging, your on-site wellness center to improve not only access, but also those outcomes for your workforce?
Yeah, so I mentioned earlier, we really look at where people want to work, but also where they want to receive care. And we even target them in that way. So if we see that people are working from home full time or someone is coming in the building, we make sure to maximize those opportunities, especially from a communication perspective. And the care should be consistent across modalities. So if they're having a virtual visit, they're going to the near site, they're coming on site, it needs to be the same look and feel, the same member portal, the same interaction regardless. And so we're really striving to make that experience an excellent experience for them. Right now, we boast a 3.5-minute wait time in our centers, which is fantastic. I was in a doctor's appointment last month and I waited 2 hours and 5 minutes. And 2 hours and 5 minutes is a long time. So I think that, just having that kind of connectedness and that great experience. And I don't know for you other employers in the room, but we have a really active community on our social media. We use Yammer, and it's called Buzz. It's our Humana social media. And it's great for word of mouth promotion. So someone will say, hey, I came in the building today, guys, just to get my allergy shot. Y'all should see me down here. Let's grab lunch. And it's fantastic to watch our people promoting these services. And I don't even have to prompt them. Sometimes I do, but I usually don't. And so that's fantastic. The other thing that we're seeing is that people are scheduling their workday around their care and around the wellness in the building. So someone will say, okay, I know I have to get my allergy shot, so I'm just going to go in today, or I'm, going to go in twice a week, and one day I'll do physical therapy, and one day I'll get my biometric screening, or I'll just check in with the clinic folks and say, hey. So I think it's really fascinating to watch some of the human behavior with this on-site access. So, yeah.
Okay, so one of the biggest things that Premise Health has really learned over the last couple of years is just the power of integration. So really having one entry point for members as they come into this healthcare ecosystem.
Mm-hmm.
So Whitney, can you talk a little bit about how Humana has really leveraged this integrated network as it has expanded into that near site space and expanded into digital? Care?
Sure. Yeah, no, happy to. So here's the thing. If you look, this is actually our near site, by the way. So if anybody's curious, like what does everyone's clinic looks like? This is our near site, the one that popped open in November of 21. Yeah. So one of the things that was really important for us was that anytime, anywhere care, what that means is that they need to see some of the same faces. They really need to have that same experience. So our providers actually rotate to the different locations. And so you can get a taste of the different provider, mannerisms or behaviors or personalities. And one of the things I'll also mention is that we've been really lucky to have some really great staff. And we actually choose many of them by some of those personality traits and just thinking about our population and our demographic and what we're looking to fulfill for them there. So I think that anytime, anywhere care is really important. The same day visits, in person or virtual, and then after hours support. Something else I want to mention that no one has really said, I don't think yet, about having a near site is sometimes you don't want to go in the office when you're sick. You don't want to be in there in sweatpants and, look like you don't feel well. And sometimes you just don't want to bring your kids to work. Okay. Having a drive up opportunity where no one sees those children is a good thing at times. So we really appreciate the flexibility of having the near site. And then there are days, if it's just well child visits, man, it's a joy to bring some of your dependents to work. My children in particular love going to the office and then they question whether they're getting a shot. But, I think that that's a unique case. Located in the community is really nice. So what we had to look at here is our heat map and our footprint of families and where people live and where they work, and then map the work styles to those people. So we can really understand what location is best for those folks. I'll share that when we were choosing our near site, there were 2 locations we had in mind. And I think it's super helpful to think about having someone who's local to advise on the placement of a near site if you're thinking of opening one. We had 2 locations, both had really good highway access. One location was next to a railroad track that's infamous in Louisville for being the longest, slowest, and the railroad that has the most action. And so you'll sit there for 20 minutes. And so we actually chose another location that's off the same highway, but it's located near a Lowe's and a Kroger and other reasons that people may be headed out that way anyway to get some of their preventive care accomplished. So I think that's great. The other thing I want to mention here is just around the integration that Heather was talking about and that point of care access. It's such a joy for our people to have one place to start. No matter the issue, let me start here. And even if it's something that I can't be seen for, if maybe it's a referral request. I had a young lady yesterday. She's 26, never been on her own, new to Humana. Just got off her parents' insurance. And so she said, I don't even have a PCP. I don't even know what to do. And I said, that's great. I have the answer. And it's great to have one point of entry for our folks and then for them to feel that connected experience along the way.
Okay, so Humana has had on-site centers for quite a few years, but you're starting to see some success of this more integrated care delivery model, when you're combining both on-site, near-site, and virtual care. So this is, an exciting time for me to hear. I know that I've seen this behind the scenes, but exciting time for you to really share what are some of the successes that Humana has been able to reap from this integrated model?
Oh, I think it's going really well. So we've had, just in the last 12 months, 3,500 visits, treated 2,200 folks. So if you think about the belly buttons, that's 2,200 people who aren't in the ER or in urgent care, out in the community receiving probably poor care than they would receive with us. And that's also 2,200 people that we were able to impact that experience and rebuild that trust. I know we talked earlier about trust in healthcare. Man, try working for Humana and having trust in healthcare, because we see a lot of the behind the scenes stuff with claims and denials and even, just some of the processes that go into it, and rebuilding that trust for our own people and just general primary care, and to see patients approaching us. And the best part of my job, I say, is that, people know that this is my role at Humana. And I'm stopped all the time. Sometimes when I'm in a hurry, but they'll stop and they'll say, I want to talk to you about my experience. And we'll sit down and they'll say, oh, it was just great. It's changed my life. I don't know what I did without it. And I tell you, these are things that they wouldn't have experienced without us and without these types of experiences that are offered to them. So I'll say also that we have a lot of unique modalities for promotion around member engagement. As I mentioned, we have a radio show. So our clinic staff, out of their comfort zone, usually, I ask them to get on the radio and they do a little spot about, preventive awareness month or breast cancer awareness month or just different things. We do magnets, we do town halls, we do emails, we do social media stuff. So I think all of that does drive that member engagement. But of course, we're focusing on where people live and work and thinking how to target them appropriately. From a clinical outcomes perspective, we've seen a lot of great work here. 76% optimization of referrals, 100% of the panel using more than one line of service. And then also we're above HEDIS benchmarks across the board. So, it speaks for itself that it's pretty successful with our group. We're looking at approximately, $1.5 million in savings. So it's a good story. It's a story I love to tell when I'm trapped in the elevator with someone and they ask me what I do for Humana. And then, I mentioned down here the reduced costs for employers and members. We do have high deductible health plans. So we do have fair market value pricing in our clinics, but, far below what they would be paying in the community. And back to my PT example, when we did a fair market value analysis, it's about $150 to $199 a visit in the community. So, just thinking about the amount of money that we're saving our people, some who are moderately paid, it's wonderful. It's a great experience for them.
So Whitney, you've shared so many little, fabulous nuggets already, in the last 15 or so minutes. But as somebody that has been in, supporting on-site services, supporting near site, and also now digital or virtual services, what advice do you have for those in the room that are either considering, dipping their toes into direct healthcare, or for those that are really considering, expanding primary care access?
So I think the first question, thinking about utilization, is can you make an impact with an on-site clinic alone? I would say for most employers, the answer would be no. So what then is the next offering that you should choose for your people? And I would say, look at, some of those extreme gaps, look at extreme spend, look at employee surveys, to figure out what might be next for you, and then choose appropriately with, a partner, or if you decide to do it yourself. I think around company culture, as I mentioned, we have our Humana well-being model, but ask yourself if your company does have a well-being culture and what that looks like to the CEO and what that looks like to the employees, because you want to have that buy-in of people if you launch something. Our people are very used to having mobile mammogram events and doing different types of things, but some cultures are not as receptive. So think about your people. And then also the work locations and hours worked. I'll give you an example. In our Tampa market, many of those folks down there are our call center associates, and their hours are 8 to 8. So from a claims perspective, where do they get care? In the ER. In the ER all the time. And it's because some of the urgent care facilities down there even close at 8:30 or 9. So by the time they get there, then they can't get in. And so that's one of the reasons that we said, look, we need to provide them with a quality experience that's cost effective for them and where they can get care when they need it. But to do so, I had to go meet with the executive leaders in our Tampa market and say, you have to give people time off. You have to allow them to get preventive screenings. You have to give them, we offer 30 minutes of well-being time right now. So for companies who don't have some type of well-being time allocated, that's one of the things, especially in production environments, that has really served us well, because you can get a biometric screening and a flu shot in less than 30 minutes. So, but anyway, that's something to consider. So company culture, population, and footprint and eligibility. So think about, if you decide you do have a care need, where is it? Who are you going to include? And then what does the environment of that culture look like, so that you can think about, hours of operation and other factors. And then finally, client advocacy. So this is where I joke often that I walk around Humana with a sandwich board on, talking about this, these on-site centers that we have available. And I think having a dedicated person in that type of role is super helpful. Not only are you responsible, we talked earlier about being responsible for this experience. I feel fully responsible. I wake up in the morning and I think about my family, my friends, and the centers. And I think that's good because you need to have an internal advocate. It's also helpful, I think, to have someone on the inside if you are a patient who's straddling the fence of making a decision. A lot of what I do are answer questions from people who are like, well, I don't know. Are you going to use my data? No. Are you, what's the experience like? How do I make an appointment? Well, let me help you. I think having an advocate that works for the employer to support the clinics is a huge win. And I think that's good.
Yeah, and that's so true. You can't just let the bus run.
Mhm.
It is very nice to have a partner like Whitney where she is advocating. She's advocating not only for the Humana associates,
Mhm.
she's advocating for the Humana people, but she's also advocating for the centers and she's advocating for us as a vendor partner too. Because, you can't build it, they're not just going to come in droves. It's got to be this continuous
Mhm.
communication, wearing that sandwich board, going out there and talking to the population and talking to them very often, because you never know when you're going to be able to flip that switch
Mhm.
and really start to engage with somebody that hasn't, entered into that healthcare ecosystem yet.
Mhm.
So.
And before we go on to the next
Yeah.
thing, really quick, I just want to mention one thing. I think it's also helpful for the staff to have that visibility with me as well. So yesterday at the outdoor office event, I was the one giving out the biometric screening form sitting next to two of our medical assistants. And I think it's helpful to just see how all in I am and how all in Humana is for this team to see that, their work is valuable.
Yep, couldn't agree more, especially with executive presence and
Yes, yeah, of
very
course.
important.
Yeah.
Okay. So Whitney, how do you continue to advocate for these services for the program? And where do you see this heading?
Mhm.
Part of what is so important is, making sure that the services aren't becoming stale, that you're continuing to be strategic with your vendor partner. And because you never know when your health and benefit strategy is really going to change and what direction you may need to move into. So how do you envision things in the future here?
Okay, that's great. Well, the first thing I think is looking, our work starts and ends with the data. So for instance, in one of our clinics right now, we're about to come into 500 square feet that we can do anything we want in that space. So I go to my vendor partner, I say, what should we do with the space? What are we seeing? How can we take some costs out of the community? I go to our associate surveys. We have these webinars once a month. They're very well attended. Our clinic staff, again, outside of their comfort zone, are providing these webinars, and over 700 people attend every single time. They are thirsty for information, and we ask a survey at the end, what services do you think we should provide that we're not? And what information would you like to have about what we do? And I mean, so you have the data there too to say, here's what we think we should do next. So definitely focusing on data-driven care. Also, your high cost claimants, really targeting those folks and thinking about the strategy for how to connect with them. Yeah, I think that's enough for that. And then pilot programs, we have a couple of pilot programs. We as Humana, we have pilots often in our culture anyway. We try things and we say, fail quickly and learn from them. But even with our PT pilot, it's a good example at our near sites. We were only offering PT in our on-site clinics. Then because of after school children who couldn't get downtown to come to these visits, we decided to start offering PT at our near site because it's more accessible to them. Well, now our near site is completely full. All the visits are taken. So now, so now we're going to extend into another half day out at the near site to accommodate some of those patients. So piloting different things as they show up. We're also seeing a need in our PT space to offboard physical therapy graduates. We have on-site fitness centers. So we're working with our on-site fitness partners to create a team project where, they're off-boarded and then they can connect with the physical therapist if needed, but they can trust that their new personal trainer is, keeping them in good care. For education, I mentioned those webinars. They've been huge for us, just educating the population around general prevention activities and just asking questions. And then also working with the other vendors. Humana has a lot of point solutions across a large variety of services. And so making sure that all of our vendor partners are educated and are aware of each other and can cross promote where necessary. And then finally, just, the partnership and learning together and, things like the outdoor office. And we saw that we were having some low completion rate with our surveys post appointments. So we've changed the model. And now you actually receive your survey right after, at the point of care as you're leaving the appointment rather than a few days later. So, those are just some examples of how you partner together and you tweak things as you go and you keep tweaking and you find out what works. So I think that those are pretty successful next steps.
Well, thank you. So I think we've got just a few minutes for questions, if there's any from the audience.
First question, has the fair market value kept some of your employees with HSAs from participating?
No, I would say no. I would actually say it's the reason that many of them are participating is because it's a far lesser cost than what they would pay in the community.
Okay. And when you decided to go near site, were you thinking of shared near site, or you've had enough population you felt that you needed your separate near site?
Well, for us, we have a pretty large footprint in Louisville. And honestly, if anyone has been to Louisville or comes to Louisville when you come to visit, they say you can be anywhere in 15 minutes. So we have, I think in Louisville alone, we have close to 9,000 employees. So it wasn't really an issue for us. We were happy to support the near site alone. But we're not opposed to partnering. We'd love that. I think any collaboration in the city is always a good thing.
Yeah. In the current near site in Louisville that we have is a shared near site. And then even having conversations in Tampa, Whitney and I, before we got started, we're just having a little sidebar. And, that's another area of opportunity that we're looking at is another shared near
Sure.
site.
Whitney, you mentioned that you've got champions. Is that their only job?
No. Well, we all have 100 different jobs within our jobs. No, these people are volunteers. But one of the things that's really enticing for them is they get information first. So they get information about open enrollment and different things, different well-being programs we're about to launch. And so I think there is value in being in the know. But no, these people are well-being champions spread out through the entire population. And this is just one of the pieces of their roles.
Yeah, I know a number of companies who did that, and it's always been successful for
Yeah.
that. Question on the cost savings. Is the cost savings 1.4 million over what period of time?
That estimate's over the last 12 months.
A year,
Mhm.
last year. And is that all the onsite and near site, or just the onsite, or the total program? What's it encompass?
That is for the Louisville population only.
Okay. And what percent, if you know, because you're a data-driven company, of your chronic disease people are utilizing the center? Because we know 18 to 20% cause 85% of your costs. Have you targeted and segmented and brought them in for your programs, or is that still a challenge?
That if you'd like.
Yeah, I don't think we've looked at the analytics yet on what percentage of those chronic conditions are coming in.
Mhm.
Yep.
Do you know what percent of your dependents you're getting?
Well, not as many as I'd like, but it's growing for us. Again, it's not ever been something that was largely communicated, even though we've been offering on-site clinics since 2012. It was always sort of an afterthought. If someone asked, we're now really going after families. We actually just sent out a note a few weeks ago about back to school physicals and those types of things. And in Tampa, I know that those are required in school, where in Louisville, they're not for all schools. So I don't know the percentage of dependents who are utilizing the center, but I do know that the number is increasing. And from what I've heard from families, they've completely taken them move their care from their pediatricians and their other primary care and convert it over to the center.
Do you know what percent of your people who use the centers don't have personal doctors and the center is essentially their medical home?
Oh, my goodness. Okay. So right now, only 40% of our people, I'll just speak Humana numbers, 40% of our employees have a PCP.
And do you communicate what the center does to those and vice versa?
We do. And one of the things we've been talking about, I think health literacy was mentioned earlier. We are trying to tell people, so I think people think wherever the plurality of their care is, that's my PCP, or a lot of people assume that their OBGYN is their PCP. I think just understanding the terminology and so people can really attribute someone and go to that person for care. So we're just trying to crack the code of education, which is funny, given the industry that we are in, but yeah.
Fascinating. Let us thank Whitney and Heather for a wonderful presentation. Thank you very much.
Thank you.
That's great.